a very, very passionate group of nurses as well that specialize in oncology, hematology, who work along with our patients and make their life that much easier. I think Kai and Janelle can be with their witness to that themselves. What we are doing here for aplastic anemia is we are using drugs that are available to us to basically treat Kai or other patients like him who we have. He's the only one at the moment that we have with aplastic anemia because it's very rare. And we are using these medications, these steroids, these immunosuppressant and immunomodulatory agents to basically keep him as stable as possible. And he's had a very nice response thus far. Ultimately, we would hope that at some point in time he's able to go off and get further treatment, curative or otherwise, but bone transplant at some point.
Thank you so much, Dr. Hannibal. Janelle, have you begun your treatment for your cancer? And if yes, what is that experience like so far?
Well, I already finished my treatment, but while I was doing it for the first time, I did it. It was very weird to have a chemical going through my body, and it was harsh on my body because I was small and I lost a lot of weight because of the cancer. But other than that, I'm glad that I did chemotherapy.
What are some of the side effects you had?
I had vomiting, a loss of appetite, and I can't remember the rest. But vom- oh yeah, I lost hair. I lost all of my hair, and I was bald for a while, but it eventually grew back.
Awesome. And you're a very courageous young lady, very articulate. I admire you. So, Dr. Hannibal, you have had to deal with children and adults as an oncologist. What are some of the treatment options available at the Celeste Bird Medical Center for persons like Janelle Charles and persons that are, well, that have been diagnosed with other childhood cancers?
Well, yes, as you said, we do treat a very um, large range of cancers, including childhood cancers. We have, for childhood cancers, since we're talking and focusing on that most, we have an excellent pediatrics team that goes far and beyond what is expected of a doctor sometimes to care for our patients, to assure that they get whatever treatment they require. We also have access to a very large range of chemotherapy drugs. We have amazing surgeons in the Mount St. John's Medical Center who also go far beyond what is expected of your average doctor to make these children as comfortable as possible and give them the treatment that they require. Now, in the case of Janelle, the treatment for osteosarcoma is primarily surgery, surgical. So, an excellent surgery goes way further than what chemotherapy, radiation, or other modalities of oncospecific treatment would go. In patients with osteosarcoma, first thing to do is to remove the cancer completely. Debulk it with negative margins, which means you remove the cancer and some healthy tissue around it to make sure that there's nothing left in the area. So that's followed by a very long and rigorous chemotherapy regimen, like the one that Janelle was describing, where the symptoms vary from just normal fatigue to extreme weight loss because of nausea, vomiting, hair loss, diarrhea, malaise, etc. Now, the great thing is that we do have options of drugs to give the patient to prevent any of these symptoms from coming on, especially the nausea, the vomiting, the diarrhea, the malaise, etc. Unfortunately, hair loss is one that we cannot control. Um, I do say this with a lot of a glee, so to say. Janelle is a tremendous warrior. She's a tremendous soldier. She's been through a lot, far more than you could expect or ask of a child her age when she was diagnosed. And she came out with her hands held up high and her head held up high because she had an amazing response to the treatment. And if there is any ambassador that is perfect for osteosarcoma and childhood cancer, it's the young lady that we have today here, Janelle Childs.
Do we have other young persons with this condition?
No, at the moment, osteosarcoma, she's the only child patient or adolescent patient that we have.
And will Janelle
We've
require
had
further
others in the
treatment?
past.
I know
No,
you stated
thankfully,
that.
she is in remission.
Oh, awesome. All right. So you've
Thankfully,
had
Janelle is in
others in the
remission.
past.
She's
Go ahead.
no, yes, we've had others in the past, of course. Unfortunately, there were elderly patients who, after diagnosis, after treatment, they did progress and are no longer with us. But as for Janelle, Janelle is in remission, thankfully. She's doing great. She still comes for her clinic appointments with her superhero mommy every 2 months, and thankfully, everything is doing great so far.
Awesome. For those of you who are joining us via Facebook, remember to share the live and tell a friend, tell a family member that we're discussing childhood cancers with Dr. Hannibal and childhood cancer survivor Janelle. And we're looking at a rare form of anemia, aplastic anemia. And we have a survivor here, Kai Drew. Mr. Drew, you would have begun your treatment at the Celeste Bird Medical Center. What are some of the side effects you have experienced thus far?
Okay, well, side effects. Um, I wouldn't say that I've experienced a lot of side effects. For me, um, what it mainly was, for me for treatment, I had a lot of medication, right? So as the doctor has listed, like vitamin C, prednisolone, etc. So those are the type of medication I've been prescribed. When it comes to the procedures now, like blood transfusion or like for platelets as well. I've never really experienced any from. I've never really experienced any backlash or anything from that. Maybe a few rashes here or there, but other than that, it's been normal. Treatment has been awesome. The doctors have been awesome. The nurses have been awesome. And I don't know if it's just my body, but it's been all right. And even sure now, I'm not back to normal. I'm nowhere near normal, but it's still there. Like it's there, but I can still do my daily stuff. But what it does for me sometimes makes me tired, very tired. Like I can't do long walks, I can't do running, I can't do any physical activities per se. But other than that, it's been awesome. And and to know that I'm kind of ill or undergoing a condition is not as bad as people may think it is. Like it doesn't take away from like your daily activity. It doesn't take away from your life, right? So I'm still doing everything that I usually do, and I have to maintain like social distance from others because of like I can contract anything that's out there. So I have to maintain a little distance. But other than that, it doesn't for me it doesn't affect my life that much in like a drastic change. But yeah. Like I said, that's just
Wow.
for me. But otherwise, it is nice. It's been a nice journey, and like I said, it's thanks to the doctors and the nurses that I would say kind of made it this, like made me be like this far, like confident, and it's it's awesome. Like I can't say much, but it's just awesome.
Wow, I love your energy, Kai. Apart from the doctors and the nurses who is playing an integral part in your recovery, how has your faith helped you? I really like your upbeat spirit. How has faith and family played a role in this jovial personality that we're seeing, despite of everything that you're going through? Okay, I think Kai is experiencing. Oh, go ahead. Did you get the question, Kai? Okay, I think Kai is experiencing some technical issues. Dr. Hannibal, we would have spoken about osteosarcoma, but leukemia is another type of cancer. Could you provide some insight on leukemia? What causes leukemia and what exactly is leukemia?
Okay, can you hear me? Good. So leukemia is basically a type of blood cancer. Simply put, it's a type of blood cancer that originates in the white blood cells. All right. Hence in leukemia. Leuk from leukocytes from white in Greek. Okay. So these blood cells, they're basically not fully developed, and they're called blasts or leukemia cells. Okay, symptoms of leukemia could include, just like in aplastic leukemia, include bleeding, bruising, fatigue, fever, especially at night, extreme sweating, and basically it occurs because of a insufficient um, quantity of normal white blood cells. The diagnosis typically is done through a bone marrow biopsy, as is with aplastic anemia as well, and the exact cause of leukemia is not well known. There are different types of leukemia. There are four main types of leukemia, depending on their cell of origin or cell type, and whether they are acute or chronic. Acute meaning more severe disease that's sudden in onset. It is much more aggressive, and prognosis is severely um, compromised in comparison with chronic leukemia. So the different types of leukemia would be lymphocytic leukemia, or types of leukemia that originate from the lymphocyte cells, the white blood cells that are specialized in fighting against viral infections, and the myelogenous leukemias or myeloid leukemias, which originate in the myelocytes or myeloblasts, which become the white blood cells called neutrophils and are the ones that fight against bacterial infections, also other types of infections. Now, as I was saying before, in acute leukemia, the leukemia is much more aggressive. It's characterized by a rapid increase in the number of initial blood cells. These blood cells bring about a lot of different symptoms, including tumor lysis syndrome, where blood cells get so great in number, they start to die um, uh, uh, suddenly and great numbers and release all of the toxins inside of these cells, which start to poison the bodies and affect the kidneys, etc. That is also There's also a very increased risk of infection in these patients with acute leukemia. So a lot of them get admitted for the symptoms, they acquire a hospital infection, they don't respond to antibiotics because they don't have competent immune system, and ultimately they decease. Now, in chronic leukemias, this is characterized by an excessive buildup of relatively mature cells. The cells aren't so different from the normal blood cells that they are completely inept to carry out their functions, but they're still not up to par. So typically, it takes months and years to progress to really severe disease. And once it does reach severe disease, it becomes acute. So it's chronic leukemia, but then it becomes acute because the cells start to go haywire, the replication increases drastically, and whereas in acute leukemia, it must be treated immediately and aggressively, or the patient would decease in a matter of hours to days. In chronic leukemia, you can monitor them for some time, you can work them up slowly, you can start treatment relatively uh, um, leniently, and then work your way up to more aggressive treatment as the need requires. But in a lot of cases for chronic leukemias, the treatment is just oral pills or monitoring with intermittent IV chemotherapy.
All right, thank you, Dr. Hannibal. I'm going to read some of the comments here with that our Facebook viewers are sending. Okay, so Roberta Ephraim, she expresses condolences to the family and friends of the late Cassie Pascal. For those of you who are not familiar with Cassie, she was a guest on this program last week, Sunday, and condolences are going out to her and her family. We have a question from Siobhan Stevens. Good evening. Is there an issue with the YouTube link? No, Siobhan, there is no issue with the YouTube link. We are live streaming on Twitter, YouTube, and Facebook this evening. Another comment from Anik Hillier. Great show, very informative. And Anik would also like to express prayers to Janelle and Kai, continue to recover, and their their condition goes into remission. For those of you who would like to donate to Janelle and Kai as they recover, as they undergo continual surgery. I know Kai in particular, you can contact Nurse Imelda Benjamin at 722-1019. Nurse Imelda Benjamin, 722-1019. For those of you who would like to assist with the medical expenses of Kai and Janelle, that will definitely be appreciated. Now, Kai, I was asking you, how has your faith helped you in the midst of everything that you're going through? You spoke extensively about the doctors, but what about your faith and your family? What role have they played during this process?
Okay, well, when it comes to like my family and like they're very supportive. Back when I was in the hospital, before my diagnosis and so on, like it was bad, right? It was bad where my mother was the one that actually was there for me the most. Like she came up to the hospital almost every day, like looking for me and so on, right? And it's something that like I lost a lot of weight and she I guess it looked very bad for me. On my end it looked very bad. But as you can see I'm a fighter. Um I'm here, I'm good and everything is nice. But like I said, I went afterwards, I went and I started passing on my knowledge onto them and so on. Like they've been very supportive, comforting me. Like even she was the one that actually came and she reached out to me and she was explaining to me about the cancer grew and like getting to know other patients or other people and knowing like what they've been through. So that as well was very comforting for me as well. While laying there on the bed, you're like, okay, what's gonna happen to me? You really don't know what the future holds. That that was like a light as well for me. Right? I started to understand like, okay, I'm not the only one that's going through this. A lot of patients out there have cancer and other sickness and illness out there. So that as well was very comforting for me as well. While laying there on the bed, you're like, okay, that helped me a lot. And throughout all these months coming down the line, like while speaking to her as well, like it's been helping me, like showing me like there's a way, right? Like I can beat this. Like I was losing hope. I'm honestly gonna let you know that I was losing hope. But after praying, after looking for some answers, I got some answers and I saw the way. And now I am like I'm not healthy, but I'm in good health. I'm in good health though, but and it's been going great. So thanks to the support of my family, of my friends, of the groups out there, it's been going great. And I think that's what others out there really need. They need not only like their family in their ears, they need other people out there to explain to them what they're going through as well. So that's something I would like everybody to get into, right? Reach out, ask some questions, and vent. Let everybody know how you feel because that will help with your mental health as well. So once again, it's all right for me, but it's a struggle sometimes, but it's all right.
Thank you
Thank
so
you.
much, Kai. And remember, for those of you who would like to donate to Kai and Janelle's medical expenses as they undergo treatment or as they continue their treatment process, you can contact Nurse Imelda Benjamin at the Mount St. John Medical Center, sorry, Celeste Bird Medical Center, and her contact information is 1-268-722-1019. Again, it's 1-268-722-1019. Dr. Hannibal, you would have spoken extensively on osteosarcoma and leukemia. Are there other childhood cancers that are presenting themselves at the Celeste Bird Medical Center or even in the Caribbean that you may be familiar with, other cases?
Okay, so we've had, in the time that I've been at the Service Development Center, we've had maybe three or four children who we have handled during that period of time with cancer. Mostly the attention is given by our excellent team of pediatricians, especially in coordinating uh, treatment that is not available here in the overseas countries. But through our department, oncology department, we have managed Janelle, we've managed another patient who recently passed after a very long and resilient battle against parotid carcinoma. It's a cancer of the parotid gland, which is a salivary gland right here in the cheek. We have a child with retinoblastoma who has gone overseas for treatment that is unavailable for him here. He's doing very, very well here. He's mostly managed by the pediatrics department. But in general, the most common cancers that present in the pediatric age, which is between 0 and 14 years of age, is neurological cancers or central nervous system cancers, brain tumors. Okay. Yeah, I think because of that, they usually present at a little bit more advanced stage because that's when the symptoms start to pop up. Other ones, other than osteosarcoma, the leukemias, is the lymphoma. Lymphomas are very, very common. That's another type of hematological malignancy that is prevalent not only in children, but in adults as well. However, in when it comes to childhood cancers, it does make up around, um, it comes in third place after brain cancer and leukemia. So yes, the other ones that we have managed, we've had a case of neuroblastoma. That is another case that was managed by the pediatric department and passed over to the oncology department towards the end of his battle because he needed chemotherapy, monitoring, etc. And unfortunately, he also uh, did not, ultimately did not um, beat the disease. But the interesting thing and the sad thing about cases like that, he was born with cancer. He had developed cancer inside of the womb. So when he was born, he had already had it, and by the time he was diagnosed, it had already spread to his liver, which is a few months. So I do urge all parents or to-be parents to go to their regular checkups during their time while they're pregnant, after the children are born, to take them for their regular checkups with their physicians, with their pediatricians. It goes a long way in helping to detect early cancer or prevent cancer if there are certain things, for example, the cervical cancer vaccine, etc., that can be administered to pediatric patients. So as I say, I always say, knowledge is power. The most that we can do, or one of the best things that we can do, is watching programs like this, reading online, buying books and reading about it, staying informed, being proactive in preventing cancer in ourselves and in our children and other diseases and life habits that we can adapt to prevent long-term issues both in ourselves and our children. And that's basically what we'll have to do.
All right, thank you. And I know last week, one of our viewers suggested that education must begin in schools. So I believe that is something Nurse Benjamin will be
Right.
considering because, as you rightfully said, knowledge is indeed power. Now I'm going to go back to Janelle. Janelle Charles, how has the cancer support community helped you during your diagnosis?
It's helped me a lot during my diagnosis. Sorry there. As I was saying, it helped me a lot during my treatment and my diagnosis because I got a lot of support because when I was smaller, I didn't really know what was going on and I didn't understand my diagnosis, but I end up growing to understand it now. And I'm glad that they have it because a lot of children out there really need the support that they have because you never know what any child is really going through. So,
And what advice would you give to young persons like yourself who may not necessarily have osteosarcoma, but might probably have another type of cancer? What advice would you give to them based on your experience?
well, to keep your head up high and don't make your cancer or whatever sickness you have stop you from being who you are. Don't make the words that people say to you make you feel like, oh, okay, I have a sickness and that's the only thing that people are going to know me for because you can have a sickness and you can also have a amazing talent, so you can use that as well and to just be brave and be bold and don't stay in a depression corner or don't be sad about what you have.
Awesome. Thank you so much, Janelle. Remember, for those of you who would like to donate to Janelle and Kaiju, you can contact Nurse Benjamin at the Celeste Bird Medical Center. Her contact information is 1268 722 1019. Again, 1268 722 1019. Dr. Hannibal, how can persons get in contact with you?
If they want to get in contact with Dr. Yaziji, they can also contact Sister Benjamin at the Sylvester Medical Center at 722 1019.
1019. All right, awesome. Okay, so we have
And she'll
a
provide them with
comment
my
from
personal WhatsApp. Yeah.
All right, so we have a comment from Alma Brooks. Praise the living God. Hallelujah. It's amazing to see the type of faith persons have when they come on the show and also our guests. Thank you so much, Alma Brooks, for that comment. Those of you who are tuned in via Facebook Live or via YouTube or Twitter, remember you can leave your comments with us. Our panel will be more than happy to respond to your questions. We also have a comment from Nurse Benjamin. Nurse Benjamin is saying, awesome advice, Chanel and Kai. Now, Kai hasn't given his advice as yet, so I have to give him the floor now to give his advice to persons who might be experiencing a plastic anemia or aplastic anemia or any other condition that appears to be a death sentence. And it may not necessarily be somebody from Antigua, because we have persons throughout the world looking at the show. What message would you like to leave with your audience this evening?
All right. Well, for me, what I would say, right? Rule number one, right? Prayer, right? Pray. Keep praying. It opens like a new gate. It opens like a different avenue, right? Somebody like for me, while praying, certain people started coming to me, and like it opened my eyes. So while praying is an option, also everybody is a fighter. The body is a vessel, right? Keep fighting, keep pushing, keep believing that, okay, one day you will conquer it. One day you'll get back to maybe a normal life. You will get back to even a healthier life. So keep fighting, keep pushing. And people need to understand that when what is any illness, what is any disease, whether it's cancer, what is whatever the disease is, keep pushing, keep fighting, and always remember that there's hope. Okay? People will find you, you will find people, and there's always hope. So keep fighting and keep pushing, and one day, like you will eventually overcome that obstacle.
Well said, Kaiju. Well said. We have a comment here from Lutella Burton. Well said, Janelle. Thank you so much, Miss Burton, for tuning in to our show. Dr. Hannibal, what would you like the audience to take away from tonight's discussion as we wind down? And for those of you who have any questions or comments, remember to send it quickly because we're about to end this evening's discussion. What would you like to leave with our audience this evening?
Okay, so I'm at a loss for words because Janelle and Kai basically summed it all up. All right. But what I would add to what they have said thus far is education, education, education. Seek knowledge, and you will have power. The more we um, are desensitized to the word cancer, because cancer is a taboo where we live. The more we desensitize ourselves to the word cancer by reading, by educating ourselves, by seeking knowledge. What is cancer? How is it treated? What is the reality behind it? What are the options there? If you are diagnosed with cancer, as Janelle said, don't enter into depression. Don't lock up yourself and say, you know what, that's it. I'm going to die. I'm not going to any doctor. I'm not going to see anybody. I'm done. That is the worst way to uh, 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 um, to go about doing things. See your doctor, talk to your family, talk to your friends, go to a support group, take your treatment. And ultimately, as Janelle said, which is very, very, very wise and well beyond her years, the cancer does not define you. It's not who you are. You are still Janelle, you are still Kai, you are still whoever you are, and that doesn't define you. So it's not, don't let it take over your life, basically. And one thing that I do have to add, which is very, very important, and I do hope everybody does take it, get this takeaway from the program. There are a lot of cancers that are screenable, that you can screen for, that can not preventable, but you can detect them at the early stage. Colon cancer, you do your occult blood or your colonoscopies every 3 years. You have cervical cancer, you can do your pap smears. I know they talked about that last episode. Uh, uh, breast breast exams, self breast exams, mammograms, and physical breast exams at your doctors for breast cancer. Prostate. You can go to your urologist and get a yearly checkup where you get a physical rectal exam. You can do your PSA every year, especially after the age of 50. So if you guys fall into the categories where you are at risk for any of these cancers, there are things that can be done to prevent yourself from getting an advanced stage disease and ultimately not being able to receive a curative treatment. So thank you as well. I'd
Oh,
like to thank you, Mrs. Casimir. I'd like to thank Sister Benjamin. I'd like to thank all of my nurses in the Celeste Bird. Medical Center's oncology department, Sister Philip, Nurse Thomas, Nurse St. Romain, Nurses Leslie and Angeline, Nurse Enrique, Nurse Joseph. You guys make working both very fun, very seamless, and very comfortable. And Sister Benjamin, you are awesome for all of the things that you have been doing for our patients since day one, and all of the efforts that you have been putting forward with the cancer support group, with events like this one and others. Keep up the great work, and thank you very much for everything.
Thank you so much, Dr. Hannibal. It's just always a pleasure having you. There's never a dull moment with you, and continue to do the great work. Continue to keep up the great work that you're doing at the Celeste Bird Medical Center. You're doing a fantastic job. I just want to read a few comments before we conclude this evening's session. Alma Brooks said, I'm locked in from Hawaii. Blessings and more blessings to everyone. Thank you so much for tuning in, Alma Brooks. Thank you, thank you, thank you. And Alma Brooks again left a comment saying, great show, very informative. Well said, Kai and Janelle, just keep the faith. And then we have a comment from Stacy Drew, and she's saying, good answers, prayers, don't give up. Awesome. I admire the faith of persons that are tuned in, and as well as the cancer survivors, the medical practitioners who come on this show. It is quite admirable to see the important role that faith plays with the medical side of things. We also have a comment from Roberta Ephraim. Thank you again for tuning in, Roberta. Very informative program as usual. And then we have Esther. Oh, thank you for tuning in, Carol, Esther, Henry. Good night and very informative. Thank you so much, everyone. Any final remarks from you, Kai and Janelle? I'm going to give you the opportunity to give your final remarks. Remember, you can donate to their medical expenses by contacting Nurse Benjamin at 1268 722-1019. And if you would like to find out more information from about Dr. Hannibal or would like to get in contact with him, you can also contact Nurse Benjamin as well at the same number, 1268-722-1019. Go ahead, Janelle. We're going to start with you and end with Kai.
Well, I just want to thank you for having me on your show, and it was very nice to be here and to have a nice discussion about both of our illnesses. Yeah, have a good night.
Thank you. And it was a pleasure having you on the show. Thank you so much for being courageous. And it was a pleasure, like I said, having you. Go ahead, Kai.
All right. Okay. Well, like the doctor said, right? You have to educate yourself, right? Education is power, right? That's how I actually learned a lot. I did my own research. I didn't wait on the nurses. I didn't wait on the doctor. I did my own research. And while doing that, it will help you. It will help you to understand what your illness is. It will help you to understand how we can treat it, how we can help treat it while the doctors are treating you as well. And it will work. It will work. And it will even open a platform to see like what others are going through and share knowledge. So education is power. Also, I would like to thank everybody for coming out. I learned a lot, and I'm always open to learning. I would like to thank the nurses and the doctors. Oh my God. Like, I would like to thank them. Like, they're awesome. I'm not gonna lie, they're awesome up there. And I look forward to seeing them every time that I go up there for my appointment. Um, yeah, and keep up the great work.
Thank you so much, Kai. And just a few comments from Angie Henry. She's saying, blessings. Good job, everyone. God continued blessings on you all. Thank you, Angie Henry, for your comment. We also have a comment from Nurse Benjamin. Great panel. And then our final comment is from Aurelia Casimir. God is awesome. God is indeed an awesome God. And I would like to extend, commendations to the nurses and the doctors at the Celeste Bird Medical Center for the amazing job they have been doing. And I would like to thank both of you, Kai and Janelle, once again for being courageous enough to speak up and to share your experiences with persons. And Dr. Hannibal, continue to do the awesome job that you're doing. Just a few takeaways from this evening's session. Knowledge is power. This is something that everyone here has said, and faith is very important. Prayer takes you into a different dimension, and also get screened. This is very important, and this is something a lot of the medical practitioners have said from the onset. It is important to undergo regular screening. So this is important. So those are just a few nuggets to take away from tonight's session. Next week, we will have Miss Corin Norton and Dr. Adrian Peters, and we'll be looking at your mental health. So I know some of our guests have spoken about how important it is to have positive people around you when you're undergoing treatment, when you've been diagnosed with cancer or any disease. So our special guest, Corin Norton, she will be providing some insight on this area. And we have Dr. Adrian Peters. He'll be discussing the physiotherapy aspect of cancer treatment. You don't want to miss next week's session. On behalf of the Community Charitable Ministry, the Cancer Support Community, and the Apex of Training and Development Show. And of course, this program could not have been possible without our sponsor, Nagico Insurances. We would like to extend gratitude to everyone who participated in this evening's show. And remember to tell a friend, tell a family member, tell a colleague about this program. We'll be tuning in next week. Well, we'll be on next week at 8 p.m., same time, same locations, Facebook Live, YouTube, and Twitter. And again, we will be providing some needed insight that could help you as an individual. Again, knowledge is power. Thanks again for tuning in, and see you next week. All the best. We have one more comment from Carol. Oh, Carol did not say anything. All right. Have a great evening and continue to remain safe. Remember, if you would like to donate to Kai Drew and Janelle Charles, you can contact Nurse Benjamin at the Celeste Bird Medical Center. For those of you who are overseas, you can send her a WhatsApp, and her contact detail is 1268-722-1019. Again, the contact information for Nurse Imelda Benjamin, who is doing a phenomenal job at the Celeste Bird Medical Center, is 1268-722-1019. Nurse Benjamin, keep up the excellent job that you're doing, and continue to remain safe. God bless. Have a wonderful evening, and see you next week. Same time, same destinations. Good night.